Real quick, guys. Today I wanted to go over how to explain radiculopathy, explaining it specifically to Spanish patients. And I use visuals. I love to explain exactly why the pain is happening, specifically with low back pain that goes down the leg. And if you have this visual in your clinic, it's going to be way easier because more patients are going to be able to relate to you versus just telling them words. Because, some people learn auditorily. I would say many people are going to understand chiropractic visually. So this is a great example. I'll explain it in English first, and then I'm going to explain it in Spanish. Try to follow. It's a little bit tougher, but if you use a couple key words like nervio or cuerda, which is like cord or string, that's how patients actually relate it to me. So I use their lingo back to them to explain simple concepts like low back pain. So I'll explain to the patient, we'll say, Pedro, the reason that you're experiencing pain that's going down the leg, oftentimes, or normally, right, I use a vague term, is because if there's a nerve that's being irritated or affected here in the low back, it can cause pain, numbness, tingling, different sensations, sometimes down into the leg or to the buttock, or sometimes all the way down to the foot. That's English. In Spanish, a little bit tougher, but just follow me. Pedro, la razón que tienes dolor aquí es porque si tienes dolor o problemas aquí en la espalda, si hay irritaciones de los nervios, es posible que tener dolor que corre así, right? Like so, así. Esa es una cuerda. Eso es un nervio o una cuerda que corre entre la espalda hasta el tobillo. Couple words that I use there. Tobillo, which is ankle. Cuerda, right? If you just start shooting out terms like cuerda, aquí, nervio, aquí. It's a cord, it's a nerve. If there's a problem right here, si hay un problema aquí, if there's a problem here, it can cause, or es posiblemente, or es posible que tener, it's possible to have pain that goes down like that. So that's a lot of words. I'll put them down below written for you just so you can look at them. But if you have a picture model like this, it's going to be way easier to explain radiculopathy. And they're going to really appreciate it because many times patients have had this condition and they've been even to a medical doctor, yet they still don't understand it because, well, the doctor doesn't speak Spanish. A lot of times the translator doesn't understand the dialect of the patient either. So if you use super basic terms, just like I did for you, the chances of you being able to explain it are going to go way up. Patients are going to love it, and they're going to refer more patients because they're going to know that you can explain simple concepts like this. So there you have it. Radiculopathy, pain down the leg in Spanish.